soldiers get shot up, they can either inject themselves with a ketamine pen or a morphine pen, actually. And what's fascinating is that the soldiers who injected themselves with ketamine pen never developed PTSD.
Ultimately, our guest today delivers regenerative medicine. And, from what we know about regenerative medicine, and I know we've said it before in the past, it's, we talk about celebrities and athletes and things like that, but I think we'll kind of flip that on a different end today, because our guest today, Dr. Joy Kong, is going to make regenerative medicine accessible to a lot of different people. And so we'll kind of talk about some of the different therapies. Ultimately, she is a regenerative medicine specialist, triple board certified, and delivers amazing different therapies such as stem cell, exosome, ozone, ketamine therapies. And I wanted to go kind of into your history, where you started, how you made the transition, and go from there.
That's quite a story, because I grew up in China, so definitely not the typical pathway. I actually studied architecture when I was in Beijing, and then I decided to come to the US, and I was 20 years old. And then I've always been fascinated by human body, so I went into medicine. And I got really excited about the brain and what psychiatry is doing to help alleviate a lot of suffering. So I went into psychiatry. But I've always found it lacking in the conventional medical approach, because you are just targeting a particular organ. Whatever your specialty is, that's what you're laser focused on. Mm-hmm. And that's just not enough. And especially knowing from my cultural background of how every organ can affect each other, there's this system approach that we can use. So because I was attracted to the system approach, that's when functional medicine kind of came into my view, and anti-aging medicine, because it's really about understanding how many things are going into the decline that's propelling the diseases. So then all of a sudden, I can embrace a system approach. And of course, part of this more cutting edge way of treating the body, this new form of medicine, embraces a lot of cutting edge therapies, including stem cell therapy. So the moment I heard about stem cell therapy, and realizing what it can do, that's when just, all fireworks are going off. Yes. And I realized, okay, this is one of the most exciting breakthroughs in medicine. So, and it's not enough just theoretically being exciting, but when I started to give it to patients, and the results are astounding, right? Mm-hmm. So all of a sudden I could accomplish things that could not be accomplished by all these specialists. I could do things I can, help save people's knees that the orthopedic surgeons could not do. They have no idea how. I can reverse somebody's lupus because that's what happened when their rheumatologists have no way of doing it. Mm. So this is giving hope to so many people. And it's fun. It's fun to be on the cutting edge, to solve problems that no one has solved before. Yeah, so that's how.
I agree with you. I think it is so amazing because for years and years and years, you're right. Each of the specialties have focused onto, one organ system. And we're now realizing, look, although that's great, the body works in synergy. Look at the relationship between gut health and the brain, and, the skin and all of the other organ systems. And so it really became a passion of ours as well. And so that's why, we marvel at this. And I've said it before in previous podcasts. I mean, I think that, big pharma here blocks a lot of these types of advancements in medicine because we haven't found a way to monetize it in a pill form. And so, the FDA kind of pushes back a little bit.
Not just a little bit.
A lot.
I think they're pushing back more. I see a new wave of efforts to suppress.
Definitely. I just saw, it was the recent results of a lawsuit where using your own, I think it was Dr. Berman that, the FDA had a lawsuit. Berman won, saying that it was part of a physician's duty or part of a medical procedure. And that part was just overturned with autologous cells, which I thought was very interesting. But I think the potential for all the things you're talking about is definitely there. I mean, there's growing bodies of research. Who are generally candidates for, these types of therapies? How do you evaluate your patient? And, who comes to you first?
Yeah. So whenever we talk about a type of therapy and whether or not it can help a condition, we need to understand what the condition, what's triggering the condition. And then how does the therapy work can that dovetail into why the disease is happening in the first place, right? You're addressing what caused the disease. So in that sense, looking at what stem cells can do, there are all these mechanisms, but 3 very prominent features is anti-inflammatory effect, immune modulating effects, and then also tissue regeneration, signaling the local tissue to regenerate. So if you just look at these 3 portions, then any disease that has a inflammation as part of the problem, or immune dysregulation, or tissue damage, any of those 3 sections, then stem cells can fit right in. So those are just 3 things. We're not talking about anti-inflammatory effects of cells, anti-cancer effects of the cells, the antimicrobial effects of the cells, and how the younger cells can elevate mitochondria function. Those are other mechanisms. But if you just look at the 3, okay, how many chronic illnesses have inflammation as part of the problem? As immune decline, immune dysregulation as part of the problem. And if you have any tissue damage, even if you have genetic disease, the tissue damage at the end stage or end result of the disease, that can be reversed, even though the genes cannot be changed.
And the interesting part is everything you're talking about actually can just fall into, if I wanted to come to you and I had no real complaints, you still can treat me for wellness and longevity as well, right?
Yeah, and that's one of my favorites, of course. I would say 90% of the people who come to my clinic have a severe health issue they're trying to address. But the other 10% are people who are doing really well. They've taken good care of themselves. But still, no matter how good you take care of yourself, there's a natural rhythm of decline, right? Of aging.
And the 90% that you talk about, what's the most common ailment, or what are the most common problems people present to your clinic? And how do you treat them?
Yeah, musculoskeletal, of course, that's the bread and butter of stem cell treatments. And that it has a huge proportion. Knees, hips, shoulders.
And you're doing direct intra-articular injections?
For me, it's always important, especially when the person's older, to combine the IV with local injections.
Right.
Because even if you have a local injury, sometimes just an IV infusion can fix it, because it invokes your whole system to come on board to attack the problem. But the cells are also attracted to the area of inflammation, and then it can exert a lot of local effects. So that's important. But if you want a lot of the signals to be at a particular location, then you put it locally. But IV, I think it's the mainstay.
And for our listeners that don't know, what are stem cells? As somebody who knows this very well, just kind of explain it to our listeners so they understand, because this is like a word that everyone hears.
Yeah.
And a lot of people are very kind of confused.
Yeah.
Stem cells, what's exosomes? What are these things?
Okay, so I want people to realize that every one of you came from a single stem cell. So that is a fertilized egg. From that single cell, whatever that's contained in the DNA, whatever that's in the cell, within the nucleus and within the cell membrane, there's tremendous potential that's encased there. And that's how a full human being can be formed. So that is intelligence. So stem cell therapy really is tapping into even just a fraction of that intelligence that can form a full human being. And that's what we're borrowing to help people regenerate and repair. And from the fertilized egg to the stem cells that's, let's say, in your liver or in your lungs, and everywhere along the way, there are different kinds of stem cells. So we can tap into stem cell potentials anywhere along this pathway. So that became a whole complex subject of where do you intercept. But right now, the most popular form is mesenchymal stem cells, the therapy, the stem cells that's lining all around your blood vessels, and they're everywhere helping you to repair any injuries in your body and providing a signaling effect. So that's the form that's popular, but there are thousands of different kinds of stem cells.
And the ones that you use, the mesenchymal stem cells, I know that there's 2 ways to do it, right? One is you can use your own, autologous, right? And the other is you can use a donor. What do you typically use? And what's your preference, and just out of curiosity?
Yeah, when I first came in the field, that was about 8 years ago, I had the option of choosing any one of the 3 most popular forms. So that's bone marrow derived stem cells, fat derived, or umbilical cord derived. So that's the most popular. So I set out to figure out which one is the best. So that's why I have actually a lecture that I gave at different conferences, but it's online. It's called Are All MSCs Created Equal? And they are not. So when you compare the anti-inflammatory actions, the growth factor profiles, how many generations they have left, how long the telomeres are, and neuroprotective everything shows that the umbilical cord cells actually is superior. Not just that, but they also are safer in the sense that if you put the cells next to cancer cells, the umbilical cord cells will make the cancer go away, whereas fat-derived stem cells is going to make the cancer grow. Partially it's because the fat-derived stem cells have aged with the person and have lost certain intelligence, whereas umbilical cord cells are so young and still very vibrant. They're able to detect cancer and tell them to go on programmed cell death. So from all these comparisons, it's not my opinion, right? It's the research results that I'm, showing to people that shows the umbilical cord cells superior. So that's where I settled down on using. Yeah. So that's my preferred.
Now I know that there are multiple different labs, both here and in other countries and things like that. And each one touts that they have the best. I've spoken to Neil Reardon in Panama, and he has, the ultra cell, the hero cell that
the golden
cell that he can replicate over and over and over and over and over. And most of our research says, look, at about 7 times that the cell is replicated, that it loses its ability, right? Exactly.
Yeah, 4 is definitely, but even one replication, one generation, there are genetic changes and problems. Yeah.
Then we talk about the different cells in the Maharaj Institute over in Florida, where they use autologous hematopoietic stem cells. Those are, for the listeners and viewers, those are blood cells that ultimately boost your immune system. We see that there's growing bodies of research with all different types, right? Dendritic cells for, neuroprotective effects. And there are just different profiles that are secreted by each of these cells, as you said. Do you tailor your therapies accordingly based off what they present with, or because those cells tend to be more potent, you generally treat with a particular type of cell?
Yeah. So the way I approached it is that I actually combine different cell types. So that's pretty unique to what I formulated, because I've used cord blood cells before, which is full of mononuclear cells, a lot of endothelial progenitor cells, fibroblasts, but the cord tissue, which contains, mostly that's where Orton's jelly is at, is full of mesenchymal stem cells. And that has been kind of the gold standard, the holy grail right now that people are using. And then you can also get cells from the amniotic membrane, which is also full of mesenchymal stem cells. But even mesenchymal stem cells from these 3 different compartments, because cord blood has a tiny fraction of it. But even if they are all from the birth tissue, because they came from different compartments, these mesenchymal stem cells express different surface markers, have different genetic potentials to differentiate. So their growth factor profiles are all different. What I did was that I actually want to combine all 3 different sources, not only the different kinds of mesenchymal stem cells, but also the cord blood cells, which have shown tremendous benefit in helping with immune disorders or brain conditions because it's so good at angiogenesis, etc. So I use a product that combines all 3 compartments. And because I've also seen in research how different cell types interact with each other. So mesenchymal stem cells, for example, help hematopoietic stem cells to engraft better, actually amplify each other's results, such as been shown in autism. Combination works actually better than a single cell type. So maybe coming from a Chinese background, always been exposed to these herbal concoctions, right? When you put different things together, they will have emerging properties. Instead of just hitting at one level, all of a sudden you've got this web of possible relationships. You're having emergent, more system level, right? You're taking a higher level look at what the system may need, and then you have emerging properties. So that's what I prefer to use. Actually pretty simple. In all different conditions, we use the same type of cells. So in the future, could it be more specialized? Yes. But right now, because we're doing what's called minimal manipulation tissue graft, we're not manipulating the cells. The moment you start manipulating, then you are going to the territory of drug production deemed by the FDA. Although I've seen a warning letter just recently to another lab, and the FDA were complaining that this particular scientist were promoting the regenerative potentials of cells from the umbilical cord, and they were saying that the cord's function is a conduit. So unless you are transplanting this cord to another person that's providing a conduit function, then you're making a drug. So that's just, it's going absolutely ludicrous.
Yeah.
So unless I transplant the cord to another person, then I can't really use that cord, can I?
Yeah.
Otherwise it becomes a drug.
Yeah, it's so interesting to me. What she's referring to is a section called 1273 with biologic products with the FDA that ultimately, there are three requirements that need to be met. And one of them is obviously we have minimal manipulation. Something has to be done in the same sitting. And then the third would be that it has to be for homologous use. And the homologous use part is what she's talking about. And that's where you have to transplant the umbilical cord to someone
get
else.
everybody.
Yes.
Yeah. The MSCs from the fat can only be used if you're putting back into the fat, right?
You're right. It makes no sense. And, again, I think big pharma controls FDA is just going to respond to that. And so it's unfortunate. That's why, for us, our clinic is governed by a different body in Mexico. It's because some countries are a little more accepting of some of these new treatments. In your opinion, with these tightening, restrictions, what do you see the outlook here? The idea for us is that we're hoping that with more and more research that you lose the blindfold and then you say, my gosh, we can use this to treat just about anything, right? What do you see the both short and long-term potential for these therapies when it comes to our governing body?
Yeah, so there are a few ways that this is going to come out, right? One is, I think part of the tightening is because this is a huge opportunity for big pharma to come in. So they could easily, as you probably know, it takes on average $2.1 billion to take a drug to market, right? So if we're going to categorize all these things that we're doing as drugs, who has that kind of money to take this to market?
Right.
So once they take this to market, when people, do you realize if a company has spent $2.1 billion to bring you some stem cell product, you don't think they're going to recoup that money? And that's not going into the cost of the treatment. So they're going to try to get that money back. Yep. And so you could see a sharp rise in the price of stem cell treatment. Yeah. And then, of course, the sequelae will be that all these people are going to go overseas to get treatment. Yep. And so then America is losing out on its edge and is also not providing a service to its citizens.
You're right.
Now, if I was someone that's coming to your clinic, and let's say I have some knee pain, is this the kind of procedure that's one and done? Or is this something that needs to be done 3 times a year or throughout my lifetime, or the IVs? How often should someone be getting these treatments to really see the benefits?
Yeah, I always say there are 2 portions of your treatment. One is the acute helping to solve a problem part. The other one is the anti-aging,
the maintenance.
Chronic, maintenance part. So if we're just looking at a problem, if it's a severe chronic issue, I give people the expectation that they may need 3 sessions. But have we seen people doing great with 1 session? Yes, absolutely. With some even severe end-stage hospice type of situations, I've seen people recover with 1 treatment. So that's possible. But I don't want to give people the expectation that this is some kind of miracle, that 1 treatment, then it's done. And if it didn't work, then stem cells is just not for me. And that's not the right way of looking at it, because I've seen people who have done 1 treatment, didn't see any changes. Particularly in my mind, I'm thinking about a neuropathy patient. By the 2nd treatment, he was able to ditch his cane. He was walking, around with a cane, but it only took the 2nd treatment. But then he also had a lot of neuropathy in his hands. And he was a writer, he couldn't write for many months. And then by the 3rd treatment, he was able to do so well with his hands, he was able to write for hours a day. So it took waves of treatment. So just think of how the body got diseased, with all these kind of dysfunctional cells and tissue. And that's going to take time to be replaced to function fully. So then that's what I would expect. And of course, I talk about this 3 stages of healing of stem cell therapy. The very first stage is very fast. It's the anti-inflammatory action. It could happen while the patient is getting infusion. I've seen that, reduction in pain, reduction in swelling, right on the table. Or it could take a few days, a few weeks, the inflammation's calming down. And the second stage is the tissue rebuilding stage. Then we're replacing damaged tissue. That could take days to months. And the third stage is the genetic modification, that the optimization that we're seeing, because the microRNA in the exosomes can actually, stem cells secrete exosomes. So these exosomes have these microRNAs that can go into cell nucleus, start to make changes in the gene expression or epigenetic changes, allowing the genes to be rejuvenated. So that effect can last for years. So in that sense, I think people need to realize that this is more complex, right? So you could have long-lasting changes throughout. So in general, I would say take months to see results, and you may need one session, you may need 3, and after your problem is pretty much fixed, then you're just looking at the decline that comes with aging that everybody else is experiencing. Then you may want to do it every 3 to 6 months is what we usually recommend.
So like, between 2 and 4 times a year. And most of these treatments are really as simple as just getting an IV drip in a sense, right?
Yes.
So it doesn't require any downtime. It doesn't require any pain or anything like that. So the treatments for the patient is relatively easy. I know that off the record earlier, before we started the podcast, you and Dr. Lakey were talking about something that we really are doing in this office called therapeutic plasma exchange. I'm wondering what your thoughts are on doing therapeutic plasma exchange prior to getting stem cell infusions. We are big proponents of it. We think that clearing out your plasma and then putting in new stem cells really will help even more. But I'm just wondering what your take is on that.
Yeah, I think so as well. I was looking at incorporating that into our practice. So I think removing the toxic or the signals that came along with aging that keeps pushing the aging process. I think if you remove those elements, then you can have a new wave of rejuvenation, and that can amplify the stem cell results.
I agree.
Yeah.
I agree.
I had a question with something that you said earlier. We talked about the 3 phases of stem cell treatment, right? And the last one you had mentioned how there are some epigenetic changes. Do you think that it actually changes the DNA, or does it change the mechanisms to allow your genes to repair itself easier?
Yeah, I don't think it changes the DNA, but it changes how it decides to express, or maybe certain methylation patterns. Some of the things were reversed, that those were not helpful for long-term health. That could be basically revised.
Agreed. It's interesting because we think about the 9 hallmarks of aging, and genotoxicity is probably the biggest one. Obviously there are others, mitochondrial dysfunction and cellular senescence, things like that. But, genotoxicity is one of the biggest ones. And whether it's from what we've done to our own body and, environmental insults, things like that, even cellular damage from the sun, the DNA just takes a beating. And so eventually that just leads to aging. So if we can somehow change that process and allow the gene to repair itself more efficiently, I think we're a step ahead of the game.
Yeah. Just one thought came to my mind. So humans, we have a reset, right? Every time we have an offspring, we've got a new reset. So your son or daughter, they're fresh, they're new, and everything is in a new state. Of course, it would be amazing if we crack the code and find out how to reset everything. But, that brings to mind that, when people say, oh yeah, my cells in my own body. So now I know something called V cells popular, and also of course fat-derived stem cells and bone marrow-derived stem cells. But all these cells in our adult body decline. And if somebody tells you they don't, then I want to remind you that your own egg or sperm decline. And don't you think the species will try its very best to make sure that the sperm and egg are preserved before you start preserving other kinds of stem cells in your body. So there's no way around it. The most crucial cells in your body for the species decline with age. So everything declines with age.
Absolutely. Now, I'm going to kind of shift things for a minute and ask you some questions about something that we don't know a whole lot about, but it's been all over the news, and there's a lot of interest in it, and it's ketamine therapy. And I know you do ketamine therapy, and it's really, really right up your alley. You're a board-certified psychiatrist. It's been used for a lot of, neurocognitive disorders, things that we really can't fix. A lot of people that, depression where you just throw lots of medicine at, or other problems or anxiety and things that we really don't have great solutions to. And from what I understand, the little bit that I know, ketamine therapy works really well. It's gotten a bad rap in the press because of what happened with Matthew Perry, and understandably so, because it was used in the wrong way. Kind of educate our listeners and us as well about ketamine therapy and how you use it and what your applications are and so forth.
Yeah, well, ketamine has been around since the 60s, and it, of course, was used anesthetic. And during Vietnam War, when soldiers get shot up, they can either inject themselves with a ketamine pen or a morphine pen, actually. And what's fascinating is that the soldiers who injected themselves with ketamine pen never developed PTSD, right? There's something really, really special and interesting about ketamine. And then it was found out that it helps with addiction, pain. And when people come out of surgery, after they were induced into the anesthetic, state using ketamine, those patients wake up not wanting pain meds, even if they were addicted to it. So it's very fascinating what it does for addiction. And then, of course, their depression starts to lift pretty fast. So being in psychiatry, the best thing we had was, well, if you want somebody to come out of depression really fast, and the shockwave therapy.
Shock 'em.
And that, a lot of people are not very thrilled about that.
Yeah.
But we can give a simple IV infusion for 40 minutes, and patients can come out of it and be lifted from that, really very much a suffering state. So what it does, I think there are a lot of things we don't understand how it does, exerts its benefit. Maybe that goes on to the metaphysical realm. And people have profound experiences under ketamine, probably tapping into dimensions that we don't understand. I know talking about other dimensions or spirituality is almost taboo in medicine. And that's a shame, because the new wave of medicine, we better accept who we actually are. So on the surface, we say, okay, ketamine induces tremendous amount of brain-derived neurotropic factor. That's one of the, the best things that we know how ketamine works. But I think it's way more than that. But it's fascinating how it can accomplish things that previously as a psychiatrist, I could not bring about. For example, I was trained at the VA. I treated a lot of veterans, a lot of PTSD. I could talk my head off. I remember talking with this World War II veteran that was in Normandy landing, talked with him for 3 years. And he previously has talked with many other psychiatry residents for years, and he's still struggling with the same problems and the same trauma. What's interesting is that the ketamine is able to help you rewire the brain. So instead of, from A to B, A is trauma, B is reaction of disproportionate reaction. Now we can go from A to C to a different place to look at the problem. And then you bypass this automatic, really maladaptive reaction. So that is tremendous in relieving human suffering.
And is that just the same kind of question with the stem cell? How many treatments are required to get that rewiring? If someone's coming to you, for example, I'm just going to say addiction, okay? Someone's is an alcoholic and just can't crack it, just does everything, and last ditch, they're like, okay, I'm going to come do ketamine. I can't get rid of it. I've done everything. I've gone to support programs. How many times do they have to get ketamine therapy?
I don't think there's a specific program for addiction per se, but we know for depression, let's just say use depression, and there is a regimen, which is twice a week or even 3 times a week for 3 weeks. So that's the first block of treatment. That will give you this rewiring.
Right.
So people usually respond to this one session, the results. The lifting of depression may last for a couple days or may last for a week. So that's how this regimen came about, this protocol. So you want to reinforce the new wiring. Let's say you feel better and you're lifting and you're thinking in a more positive way, and all of a sudden that whatever that's pushing your depression to happen in the first place, the stress in life, everything is pushing you back. And now if you give another wave of therapy, then you're reinforcing that new pattern of more positive way of adapting. Yeah, that's why you want to reinforce until the pathways are more secure. And then you can slow down your treatment, usually recommended once a week for a few weeks, and then once every 2 weeks for maybe a couple months, and then once a month.
Amazing. And what's your recommendation for our listeners? I mean, I would obviously say to come to you, but what is your recommendation if someone's vetting out a ketamine clinic, for example? Because again, There's been so much in the news, especially recently. What is the best way they can get this treatment, but in a safe environment? You're a board certified psychiatrist. You do this regularly. So obviously, if you guys are looking for someone anywhere in this area, please come see Dr. Kong. But what if they can't come right here and they're looking for someone in their area? What should they look for that makes it safe for them?
Oh gosh, you really have to look in the eye of the doctor that's going to treat you. I mean, we're coming to a whole different arena that this has to be somebody with integrity, with goodness in the heart, and it has to be a healing environment, because I've had patients who did ketamine treatment at a different doctor's office and felt that it was a dark experience, that it was not positive. And after coming to our clinic, all of a sudden the experience is completely different. So I think the healing environment, what kind of clinic it is, what kind of vibrations and energy that's part of the clinic, that's all important.
See, that's the Chinese holistic approach. Make you feel like it's all very zen, and it's true. I think it's very important. And you get a certain vibration from everybody that you meet, and especially if you're going into a metaphysical state, right?
You become
if you're in a bad place, it could be awful. Not that I've ever done anything like that.
You're much more sensitive to what's going on around you. I realized that if I want to test out something, let's say I put some ketamine in me and I could sense things that I normally, ability to sense, like different form of therapy, energy therapy.
Sure.
I actually have a red light helmet to help with, whatever brain health. And I would put it on my head. And if I try to meditate, I wouldn't notice anything. But let's say I'm in a clinic and I inject ketamine in me, and then I put the same red light helmet on myself. Then that's when I say, oh my goodness, it's working, because it completely changes. It changes your experience under ketamine, with or without a helmet. So that this is doing something that's pretty profound in your, on the cellular level.
Your brain chemistry, definitely. I mean, it's such, listen, I think we're at a point in medicine right now where we're about to discover some amazing things. We're on the precipice where we're rewiring neural circuitry. We are, replacing and regenerating cells. And where do you think the future this is going? Is it scary?
I had a vision, Dr. Lakey. We could be sitting down 30 years talking to each other and looking exactly the same way.
There's a very good possibility the two of you will.
I'm serious. This is so exciting. Never ever in human history. Never ever in human history have we had the ability to stall aging. If you think of all the kings and queens in history, right, for the last thousands of years, they're powerful rulers, and they may send out people to get the fountain of youth, and nobody had come back, brought back anything that's actually going to stall their aging process. They all age and they die, and that's it. But now you don't have to be a king or queen. You can be somebody that have reasonable means, and then you can get the benefit that they have been seeking for thousands of years. So this is just an incredible time to be alive.
It's so exciting. Well, look, we've definitely learned a lot here today. I'm so thankful that you joined us, because, I think our viewers and listeners, they definitely want to hear about this, right? They send us all these emails and say, we want cutting edge, we want longevity, but ketamine therapy came up. It said, again, tell us the cutting edge advancements in these and what are we using it to treat? So I think for, those of you who are struggling with PTSD or depression or things like that there's some type of trauma in your life and you just can't shake it, I think ketamine therapy is an amazing, amazing option.
Exactly. And the reason I have it partially is because mental health conditions are so hard to treat. And I've tried to use stem cells, but the stem cells is not enough to help with mental conditions. There's something else that's at play, besides all the holistic approaches and et cetera. But ketamine can bring a person to a place that is almost beyond of what we are able to tap into with all the drugs and all the supplements. So I think that's why I mentioned metaphysics. I think there's something beyond this realm that's able to help. Yeah, and that's a whole other subject.
Agreed. Listen, we'll have you back to talk about that, because I agree with you.
But with all of that said, if our listeners want to learn more about you and get in touch with you or come to your clinic, what's the best way for them to contact you?
I think the best way is just to go on my website, drjoykong.com. Has everything that I'm doing, including my memoir, Tiger of Beijing, if they're interested.
Amazing.
We're interested. We're going to get after that.
Oh, thank you. And then the stem cell training. I have an academy. I founded an academy that I train a lot of physicians in stem cell therapy. So I do that. And then there's a stem cell cream that I developed, Chara Omni, that's 100% natural. So that's there as well. So that's a really good place. And my YouTube channel, Joy Kong MD, has a lot of information, I do a podcast as well. So that's a really good place to just follow all the information I'm trying to provide to everybody.
If you like this video, you're going to love this one.
By applying these techniques to my own life, I was able to reverse those chronic diseases in myself and get off all medications, basically.